I'm back here at the Harley Street Skin Clinic getting as much info as I can out of Dr. Armour Khan, who's the co-founder of the clinic. And today I wanted to ask him about, now as every woman ages, and I know this has become my bête noire, is you begin to get these little lines around your mouth. And I never really had them until quite recently, and they just seem to be growing so fast. And I know it's a tricky one. And I know that some people will put fillers in their lips and up there, which I personally don't fancy. But what else can you do? I mean, is there anything you can do?
I think to understand why it happens is really important. Just like hands, the reason why hands show aging before the rest of the body is, number one, they're exposed, we're washing them all the time, they have fewer sebaceous glands, and they dry out. But also, we're using them a lot. There is a lot more motion in the hands and a lot more stress in the hands and the tissues than there is elsewhere in the body. And I suppose similarly around the mouth when we're talking
and eating.
We're eating, we're talking, we're enunciating, and especially with singers who are having to hold their mouths in a certain way, there are stresses, and those stresses actually cause a change in the tissues. Those stresses will break down tissues, and then your regenerative processes will build them up again. So when we're young, the regenerative and the degenerative processes are balanced. Also, sunlight exposure. Our hands are sunlight exposed. This is an area which is really exposed. And so we have lots of factors which will push on the aging button. And we've got some factors which are pushing on the regenerative button. So there's a balance. However, we reach a stage in our life where there's a tipping point, where regeneration and degeneration tip the other way. And of course, environmental factors, what we eat, how we eat, smoking is a huge factor.
Well, you can always tell a smoker.
Absolutely.
They're the first to get.
But I've got patients who've got very fair skins, they're type 1 or 2, they've never smoked, and they've got smoker's lines. And they look like smokers. They look as though they have smoked all their lives.
And why is that?
And that's because of the type of collagen genetically that they produce. So the lighter the skins, the more likely you are to develop these lines earlier. We'll all get them eventually. So combination sunlight.
And if you talk less, I do talk quite a lot. Do you think that's?
I think that's generally why women have more lines as well. But it's not that you're talking less or more. It's your genetics. The fact how you talk as well, because I've seen women who hardly have any, but when they talk like this.
They're not very animated.
They're not very animated. And if you're somebody who is animated, and somebody who likes to express, not just by your gestures, by your face, and it's going to cause more stress.
Okay. So what is the solution? What can you do?
Well, not talking isn't the solution, really. That's not.
Thank goodness.
I think being aware of it is important. So, what can we do? I've talked about a number of different factors. So, one factor is. And
by that, I mean, are there any treatments?
Well, there are. But prevention is also an action, isn't it? And not taking preventative action is an action.
Absolutely.
So whatever we do or not do is actually a decision. So if we decide to protect our lips, so exfoliation is really good around that area. Particularly. And if you're going to do extra exfoliation or leave it on for a bit longer, this area is important. And it recovers because it's got, as opposed to the hands, it's got more sebaceous glands. So you've got opportunity of stimulating those and the stem cells within those glands. So by exfoliating that area and hydrating that area, you can do a lot to help slow down that process. Treatment-wise, if there is a lot of movement and you're not a singer, then maybe very light amount of Botox in that area can help relax them a little bit. Too much of it will make you dribble. But it's not the end of the world because it only lasts 3 months.
So you mean the Botox to stop the movement?
to reduce the movement,
Reduce the
not to stop it. So Botox is one. Microneedling, just a little bit, very lightly.
So I have tried microneedling.
Just to
a little
stimulate.
bit. Yes, I love it.
Yeah.
It is good actually, and not that painful. So
No,
that's
doesn't
very
have to
nice.
be.
No.
It's only if you go very.
Well, the one I
recently.
have is very light.
But if you combine that then with a peptide serum
Yeah.
or a stem cell, a recombinant stem cell serum, which has stem cell peptides in, that will then penetrate, because once you do a microneedling, you break down or you open up the channels that go right down to the dermis.
Right.
And whatever you apply within sort of half an hour to 40 minutes after that will actually penetrate to the mid-dermal layer where the cells are and stimulate the cells. So,
So hydration is key, and there are a few treatments that put hydration into the skin, aren't there?
yeah. So, hyaluronic acid treatments. Hyaluronic acid attracts water, so it'll hydrate. It can be used as a filler, but a very light hyaluronic acid, something like Profilo, it's got a high density and low density, but they're not really cross-linked, so they spread into the skin,
Right.
and they spread out, and they hold water superficially and deeply in the skin.
Right.
So that could be something.
So is that really quite effective, do you think?
It can be very effective in somebody who's got early changes.
Right.
Once they become fixed, because you can actually get scarring along those lines, fibrosis,
Scarring caused by
sun damage, excessive movement,
scarring
inflammation.
as in actual scars or wrinkles?
Scars. So some people actually have very fibrotic tissue down in those crevices.
Wow.
That's somebody who's been significantly sun damaged, who hasn't done anything about it. So eventually you will start to get what we call a fibrotic change.
Good grief.
They're
Something to look
more
forward to.
difficult to treat.
Pardon?
They're more difficult to treat. And other
Yeah,
treatments like peels and lasers and things like that.
So exfoliation, peeling, hydration,
Thermal stimulation.
We're going to start talking like that.
We've all talked about it.
Okay, well, thank you very much.
You're welcome.